Hi, my name is Maria, and I'm going to go over two of the prevalent cancers in the United States today, one of them being breast cancer. Breast cancer is one of the leading cancer killers amongst women. Some of the risk factors include inheritance of the cancer gene BRCA1 and BRCA2, also a family history amongst one of your first-degree relatives, such as your sister or your mother. Women who are between the ages of 30 and 70 are at higher risk. Although women are at higher risk for developing breast cancer, it does not mean that men cannot develop it, because they can. Increased estrogen exposure. This includes women who do not have children because there is no disruption in their menstrual cycle. Also, women who have a high number of menstrual cycles. Also, the use of oral contraceptives. Women who are undergoing hormone replacement therapy as well are at higher risk. Also, obesity is a risk factor because fat does produce estrogen, and high consumption of alcohol can put you at risk for this cancer. Ways for early detection. There are 3 ways we would do this. We have the breast self-exam, we have the breast clinical exam, as well as the mammogram. It is really important to stay on top of this so that we can detect this early to prevent the prolonging of the treatment and also increase your chances of remission. I have this poster here. It goes over 3 steps to conduct a breast self-exam. While lying down, use the 3 middle fingers and apply 3 levels of pressure in a circular motion. Follow an up and down pattern. Check for changes with hands on hips and chest muscles flexed. Examine underarm while upright with arms slightly raised. These are posted in the doctor's office. You can also consult with one of the medical professionals if you feel that you're not quite sure if you're doing it right, or if you don't know exactly what you're looking for. This is recommended that we conduct this on a monthly basis. It's simple that you can do while you're changing, or something you can do when you're in the shower. The breast clinical exam is very similar, but it is done by a medical professional who does know exactly what abnormalities that we're looking for. This is done on women between the ages of 20 to 39 every 3 years, and after 39 it is recommended that it's done yearly. Mammograms are done yearly for women over the age of 40. If there is a suspicious mass that they find in this mammogram, a biopsy will be done to further explore what's going on. Treatment of breast cancer, stages 0, 1, and 2 would require a lumpectomy and breast irradiation. As for later stages of the cancer, you would require total mastectomy, or a radical mastectomy, or a modified radical. In a total mastectomy, you would remove the entire breast, and the infected lymph nodes. With the radical mastectomy, you would be getting rid of the breast, lymph nodes under the arms, the fat, and the muscle. With a modified radical, it would be the same, except you would not remove the muscle. Also, in later stages, you could undergo immunotherapy, which shrinks the tumor cells as well as stops the multiplication of these cells. Hormonal therapy, which stops the estrogen action, as well as chemotherapy, which blocks the tumor activity. The second cancer that I'm going to discuss today is skin cancer. Some of the risk factors include fair skin, those who are lighter in complexion; heredity, if you have a history of a first-degree family member who has skin cancer or has a history of skin cancer. This includes mom, dad, brother, sister, or having 2 or more relatives who have a history of skin cancer will put you at risk. Prolonged exposure to UV light. Anyone who spends a lot of time outdoors, sunbathers, construction workers, any part of your body that's exposed to the light is prone to getting skin cancer. History of excessive sunburns when you were younger, spending a lot of time outside or in the summer times and you got a lot of sunburns, this puts you at risk. Having several moles, varying sizes, or having family history of unusual moles will put you at risk as well. There are 3 different main types of skin cancer. We will refer to this to kind of give you a look. We have basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. Basal cell carcinoma, it is rare for this to metastasize. For basal cell carcinoma, you are at risk for this if you are over the age of 40. For squamous cell carcinoma, having a high amount of x-rays or trauma to an area such as burns or ulcers. Also having a weakened immune system or changes in genes related to melanoma. For malignant melanoma, this is one of the most common cancers amongst women 25 to 29 years old. This is second to breast cancer in women 30 to 34 years old. You are at risk for skin cancer if you are younger than 40 years old. 50 years old, that is, sorry. If you reside closer to the equator because of the increased intensity of the UV light in that area, you are at risk. Also having light blue eyes, light hair, or skin that burns easily. This could mean freckling. Early detection, it's a good idea to always monitor your skin and keep a lookout for any new moles or areas that are pigmented. Any changes to your skin really isn't good, and you might want to follow up with the doctor, especially if you see a change in the size of a mole or a pigmented area, the color, or even the shape. It's a good idea to follow up so that they can do a biopsy and rule out cancer and get further evaluated. Kind of to give you an idea of what you should be looking for. For basal cell carcinoma, these look like moles, pimples with pearl-like borders. They could be scaly, crusty, and may bleed. Squamous cell carcinoma can be flat, red, scaly, or slightly elevated. For malignant melanoma, we would look for key signs of A, B, C, D. Asymmetrical, borders that are uneven, colors, they're usually more than one color, and the diameter. Their diameter are usually bigger than a pencil eraser. Treatment includes surgery, cryotherapy, and freezing with liquid nitrogen, but for later stages of skin cancer would include chemotherapy, radiation, biological therapy, which helps fight the cancer, as well as target therapy, which actually targets the cancer cells itself.
Hello, my name is Vartan Balyan. I will be presenting to you today how people are affected by cancer. When a human being finds out he or she has cancer, it will affect them personally, psychologically, and socially. We will look at the personal effects first. A diagnosis of cancer can be very overwhelming for the individual as well as to their families and friends. It can change relationships, some by bringing them closer together and some by pulling them apart. The stress of the cancer can create new problems in a relationship and worsen existing ones. Each person will be affected differently, so it is important to treat each person according to his or her needs. Keep it simple and try and tailor your help to your own unique dynamic with that person. Most importantly, listen to them. There are many different cancers, and a lot of them have similarities in the way that they will affect a person. We have chosen to focus on skin and breast cancers. When a person has skin cancer or a woman has breast cancer, they have to deal with the questions of will they be cured or will they die from the disease? Dealing with your own mortality for most people is a difficult thing. On top of that, now comes the inconvenience of having to constantly make doctor visits for possible chemotherapy, radiation, and surgery. The person's life is now turned upside down. No longer do they have the time to do the things they want to do in life, such as their daily hobbies, activities, and recreational fun, along with their normal responsibilities in life, such as work, raising a family, and maintaining a household. Their focus now becomes something as basic as survival, something that a lot of us take for granted. When diagnosed with skin cancer or breast cancer, and an important part of determining to what degree the cancer will affect you is understanding what stage of the disease you are at. This is done with a lettering and numbering system. The letters T, N, M are used. T describes the original tumor, N describes whether the cancer has reached a nearby lymph node, and M describes whether the cancer has metastasized to distant body parts. Once these are determined, they are combined for an overall stage, which are numbered from 1 through 4. 1 being least advanced, and stage 4 being the most advanced cancer. The personal effects from skin cancer, depending on the type, can be minor, with just small biopsies of the skin in stage 1, to major tissue removal in stage 4, along with chemotherapy treatment and possible radiation, followed up with proper care and lowering the risks of a reoccurrence of the cancer by staying away from tanning beds and keeping sun exposure to a minimum, along with protecting yourself with sunscreens, clothing, hats, and sunglasses. Breast cancer effects are also minimized when detected early. Stage 1 patients may only need a lumpectomy, which is removing just the tumor from the breast and performing some radiation in the area, as opposed to stage 4 patients that need more aggressive surgeries, like a total mastectomy, where the entire breast is removed, or a radical mastectomy, where the entire breast and underlying muscle, as well as the underarm lymph nodes and fat, are removed, causing the need for the addition of cosmetic surgery to restore a woman's appearance for those who choose to. Thank you. As well as the personal effects, there are also the psychological occurrences of cancer. A cancer patient can be affected psychologically in many different ways. They can have bouts of depression, fearing the worst of the disease, causing them to feel mentally depressed and not able to enjoy life. They can have times of anger, questioning why they are the unlucky one to have to deal with the disease and all the problems that come along with it. Sometimes it can lower their self-esteem and give them feelings of being vulnerable. They can also have feelings of denial, which may keep them from actively fighting the disease. Mental stress about finances, fear of the unknown, and side effects from treatments can cause the immune system to weaken and affect the body's ability to fight the disease. Breast cancer patients that have had to have a mastectomy can psych themselves into thinking they are no longer beautiful or physically attractive because they may feel a part of their femininity has been taken away. The disease can give them fears of reoccurrence in the other breast, causing them to decide to remove both breasts as well. Their anxiety level may increase, worrying about how the opposite sex will view them, which can also affect their mental well-being. Breast cancer patients often experience recurrent nightmares and experience difficulty sleeping. Their ability to concentrate and focus on tasks at hand are also effects from being diagnosed with breast cancer. Skin cancer patients in severe cases can be left with disfigurements, especially around the face, where it cannot be hidden. Some patients must have large sections around the face, including the ears and nose area, removed due to the cancer. Those areas are often then grafted with skin from other parts of the body, but will never look the same. Getting over the psychological effect will be very challenging. Extensive counseling, therapy, and support will be needed from professionals, family, and close friends. Hello, I will next be discussing the social effects of having cancer, namely breast and skin cancers. A cancer patient can also be affected socially in different ways. They can be looked at with a stigma because of the cancer. Friends and family that cannot cope with the disease can abandon them, leaving them to feel isolated, lonely, and shunned. Cancer can leave a person with feelings of hopelessness, keeping them away from social situations and living life normally among the population. A woman with breast cancer goes through numerous types of feelings, depending on what stage the cancer has progressed to. She can go from feelings of just wanting to be alone to the need to be surrounded by family and friends. A diagnosis of stage 1 or stage 2 breast cancer, causing the patient to need a lumpectomy and weeks of radiation, can create short-term social exclusion due to pain from the surgery and also lack of energy from the radiation treatments. She can also be withdrawn socially, worrying about whether the cancer is completely gone or will it come back again. Higher advances of the breast cancer, like stage 3 or stage 4, which necessitates removal of one or both breasts, can also cause social effects. If a woman has had one or both breasts removed, she may experience feelings of inadequacy and lack of sexuality, which will cause her to shy away from her partner, or if she is single, it may keep her from meeting potential mates because of her change in body image of herself. The breast cancer can keep her from participating in activities like jogging, dancing, and sports due to pain and treatment-related problems. Social situations like going to the beach, going swimming, or to a barbecue will also be hampered because of lack of self-image from hair loss or breast reconstruction due to the breast cancer treatment. Skin cancer patients are also affected socially in that many skin cancer cases are related to the face and scalp area, causing body image concerns for the patient and choosing to stay away from social situations due to the embarrassment of their condition. They may have scars from treatment or disfigurements to the face area that make them very self-conscious and also keep them from attending social events. Having any type of skin cancer means that you must stay out of the sun or keep sun exposure to a minimum, which will also limit outdoor social contact, especially during the summer months.
Living with skin cancer is a life-changing event for a person that is newly diagnosed or a survivor. Surgery can leave scars on the skin, which means mentally coping with your physical appearance can become a very tough hurdle to overcome. Those that are living with skin cancer have to deal with the awkward stares and the compressing questions while trying to maintain their normal lifestyle. A person that was once used to laying out in the sun or going to tanning salons is no longer allowed to do so. Instead, they have to cover up from head to toe because they cannot be in the sun. And they have to wear sunscreen. Cancer diagnosis typically triggers an even greater need for communication, which is why having support from family and friends or even a professional expert to make this transition a little easier on a person. Letting your loved one know that they are still beautiful or handsome is another way to reassure them that they don't look unnormal. Being able to open up and talk about how you are feeling and voicing your concerns can help others to better understand how to help you. It is also important to keep your stress level down. One way of doing that can be exercise. Exercising can help reduce fatigue and also help you have more energy, as well as improve your physical and emotional health. It improves your cardiovascular fitness. It makes your muscles stronger, in addition to lowering your anxiety and depression. It also makes you feel happier, as well as helps you feel better about yourself overall. There are skin cancer support resources that are available to help one in need, such as support groups and state-funded foundations. Support groups can help a person by giving them the right resources and information that they need so they can become confident about themselves again. Meeting others that are going through the same life-changing event can also help with reassuring yourself that you're not in this alone. There are foundations that are out there that are bringing awareness to skin cancer, as well as educating people on how to reduce the risk of getting skin cancer as well. In addition to support groups, there are professionals such as social workers who can sit down with you and have one-on-one conversations and give you extra information and resources on how to deal with living with skin cancer. Educating yourself is key. It can also be therapeutic as well, because you can educate others who may be going through the same life-changing event as you. With physical conditions of breast cancer is by being a supporter for someone who might be a friend or family member that is going through a difficult time. When a woman undergoes surgery to have a mastectomy, the way she may feel about her body afterwards can lead to deep depression. There are breast prostheses that can help a woman feel complete again. Every year, thousands of women will wear prosthesis for the first time in their life. Breast prostheses are artificial breast forms used to restore shape. Dealing with breast cancer can present many challenges that a person may not overcome alone. Identifying a good support system is key to dealing with the social challenges of breast cancer. There are many social support groups that are available to aid someone in need, both physically and mentally. Two of the social support systems available are open and closed memberships. An open membership allows members to come freely without having to commit to anything. A closed membership requires a person to register and commit to a certain number of sessions. There are also small support groups that consist of women who are survivors of breast cancer. These groups are an opportunity to use knowledge and past experience to help educate other women that are going through this life-changing event. One way to aid the open and closed membership groups are to supplement these social arenas with physical activities. Regular physical activities can help maintain or improve your health during and after treatment, and can also help your mental well-being by reducing anxiety, stress, depression, and improving your overall mood. The different types of physical activities that a person should involve themselves in is gardening or housework, or even joining a dance class. Or they might enjoy the outdoors where they can take hikes or brisk walks weekly. It is a fact that social support increases the quality of life after breast cancer. Coping with life after breast cancer can be a challenging time for anyone. The time it takes to recover varies from person to person. As long as a person has the love and support from their family, friends, any loved ones, and have the right resources, anything is possible to overcome.
Hi guys, my name is Samantha Perez. I'm going to talk about ways to assist with the psychological conditions of a cancer patient. To be supportive, one must be knowledgeable about the type of cancer. There are so many types of cancers and they are all treated differently. Today I will talk about ways to assist with both breast and skin cancer. Many cancer patients will feel self-worthlessness, and that is one of the biggest challenges that they will face. It will cause the patient to bring themselves down instantly when really there is much more to help cure the disease. It does not always end in death. Because there are different stages to cancer, it is best to educate the patient as to a timeline of what they will encounter with the disease. When a patient is in a stage of self-worthlessness, they can go through denial, anger, bargaining, and acceptance. They begin to grieve and give up on their lives. When helping the patient with psychological conditions, it is said to help with spiritual and emotional support. Emotional support can be accessed through spiritual beliefs and within this patient's household. When having a cancer patient in your household, it is best to take on the everyday tasks that this patient might go through. We must remind this person to engage in their everyday physical activity because the disease is known to be very chronic, so a person's health does not mean that the individual must begin to mold their everyday task into what they expect their life to be 5 years into this disease. Many can bury themselves in depression because they believe this is the end. The disease has taken over the brain and not their body. Again, being in contact with their spiritual beliefs can help give this person help. There is medication that physicians can prescribe to depressed cancer patients, but to better assist them, it is important to remind them, depending on how healthy they are, that it is possible to engage in their everyday activities. Signing up for a sport or any type of recreational activities will help refrain from negative psychological thoughts. It can bring exercise into a patient's life, which they can benefit from, something to look forward to, and something to be held accountable for. When assisting a breast cancer patient, patient's psychological needs will make a patient feel good when their household engages in breast cancer awareness activities such as Walk for Cancer or any representation that you recognize their disease and are fighting for their health and cures just as much as they are. When dealing with skin cancer, to better assist patients' psychological needs, it is possible to engage in their everyday activities. There are actions that a household can also adopt from a skin cancer patient. Putting on sunscreen with the patient can benefit the household and remind the patient that it is a very common disease that isn't as harmful if cared for. When going out, it is also a good idea to, just like the cancer patient, wear clothing that will help avoid the sun, something as simple as a hat. A recreational activity is also something a skin cancer patient can adopt. There are so many indoor sports that they are able to participate in, and by joining with them, it could give them or ensure them that they are cared for. Although skin cancer is very common and highly curable, it is still very important that patients are educated in the stages of their cancer. It is even more important to remind them of any protective wear like sunblock and sun hats that are crucial to the road to being cured. Educating them about ways to care for themselves is important to practice throughout their lives. It is a habit and a new lifestyle that they are benefiting from by adopting.